Today we're going to talk about how many of you have been going to a car accident. Or let's say you're going down the stairs and all of a sudden you miss a step, you break your nose. Or you're on the parking lot, like the patient I'm going to talk about today, and you don't see a border where you should stop the cars, and there's no car, you don't see that border, you jump, fell. But the worst part for us in this channel is how do we save the teeth? Because when we hit, if we don't put our hands, like this patient, she fell, she hit in her jaw, as you can see, and this area, which is like when you open your mouth, this is your jaw. So she hit in all this so hard that the impact was so big that, guess what happened? The patient got affected, this area of the teeth. So we have several types of injuries when we have, let's say, a car accident, or you have a problem on going up the stairs, you hit a door, and you fracture this area, or you fracture the tooth in this way, or like this patient, she fractured this tooth, guess what? Not in this area, inside, in the gums. I'm gonna show you. So inside of this is your root and your nerve. But this patient started having all these oblique cracks or fracture. I mean, you're gonna see on the screen, I'm gonna go in a second. And she didn't have any tooth here, so she has one here that, guess what? She fractured also in the root that is a little bigger because it's a posterior teeth, and she fractured in this way also, in one way and the other way, exactly like the other. So the whole root of this patient also was full of fractures, not even a crack, not even a fissure. So we send the patient to have a CT scan. That's what we do in today's day. I usually send them to UCLA or USC, and they have a CT scan of your root, and then we can see the root to the whole extremity. In this case, I have a close relationship with the patient, and we were able to send it to an oral surgeon in our building, and then the CT scan was showing some lines of fractures, but I'm so conservative, and the patient wanted to save the teeth, that we decided to wait for symptoms to arrive. So tip number one I'm giving you right now is do not have any endodontic test unless you go to see an endodontist after 14 days. If your dentist said that you need an endodontic test, you can tell them to call me, because usually the endodontist, we don't want to see the patient for that until 14 days later. Or if, like, I'm a researcher, I did that during my PhD in craniofacial molecular biology. Okay, I want to know more, and I wanted to know why I have to wait. Well, first of all, the 14 first days, the nerve is it's so messed up in the brain and the cells, and you're gonna see an image where we have the nerve inside of our tooth, and we're gonna have these images, and these images like this, where you see here, and you're gonna see an image also showing on the screen, but this is an image of a root. A patient hit and fractured this root, and sometimes the tooth is out. We have an episode of that when you have a trauma of that time, I think it's in season 1, and the tooth is out. What do you do? How do you keep the tooth and place it back, etc.? But in this today is a specific case of this patient where it was critical. She's 84, and you're gonna see now the patient, when she fell, she had the face, it was purple completely, and she was devastated, of course, and didn't know what was going on. She didn't lose her, her common sense or anything. She continued walking. However, she was devastated because she opened her lip. And I have a really close relationship with this patient, so I was a little mad that she She was not with anybody else, but everybody have to take a look. It doesn't matter if the patient is 84. At any age, we should take care, because when you break one of these teeth, it's very traumatic for you. So the tip number one, don't let anybody do a root canal before 14 days. Wait 14 days or more. And these patients, sometimes I think I work like, if you 16 days, 2 months, 3 months, I was doing tests regularly to know, because the nerve and the pulp, which is part of the vessels and the arteries, they work in a different way, and the cells react in different ways. So now, look at the purple face of the patient and look at her lip. They were able to, to suture. Dr. Frank Vijay, which is a prosthodontist, but also it's an amazing surgeon, was able to suture her lip. And immediately we took an X-rays, and we have to wait for any diagnosis of the teeth, but especially I put numbers here, but especially the teeth that they were more affected. So when you look at these X-rays on the upper area, the upper left and the upper right, these are X-rays. They're a little dark, but these are X-rays of, this is the tooth that has a couple of fractures. How do we know? Because we saw on the X-ray, but really doesn't show too much. Even if I make a big image of this, you will not be able to see it. I can show you in a part 2, because this is part 1. How do you see on the CT scan when it's a fracture? It's fascinating, and I want you patients to be knowledgeable. I give you all my education so you can learn what to do if you have a car accident or any type of accident this happened to you. So if after 14 days the nerve is dead, they have to do a root canal. But in the case of this patient, look at this white material is what we use to finish to do a root canal. But over there on the upper, we wait from August all the way to December, when the patient starts developing symptoms like sensitivity. She couldn't bite, she couldn't put the teeth together. She was also, you get depressed. At that age, and now you broke all these teeth. So she's asked me to please save it. So we checked these tooth, finish a root canal. And unfortunately with a microscope, and I didn't want to take more pictures because of the patient's age. And she started getting sad and knowing that here she has a couple of oblique fractures, the way I was showing you, and she's gonna lose the tooth. So the sad thing about this situation is that telling the patient you're gonna lose this tooth, but then I saw the next one. You see here is a white color area, that's the bone. This area that you see, this around, that I'm going around the root canal, is the sinus. And here is the other tooth that has an infection and also was fractured, and it has to be extracted. So now the patient doesn't have this tooth. If I show you in part 2 the X-ray without them, so they extracted this tooth and they extracted this tooth. Number 6 is this tooth, and number 4. She didn't have number 5. But in any case, we continue. We finished in December because she had symptoms. She didn't want us to touch her first. So now, what do I have to do? After the 14 days, which I were not 14 days, I were like 18 days. And then again and again until December, we start doing a diagnosis. And look at the screen now. You're gonna see how the patient is going to cold test. And what we use for cold test is a CO2 test that it's a tube that you're gonna see here right on the screen. Look at this white thing I have on my right hand. That's what we use to do the cold test. And now that she doesn't have that inflammation, she can give me a more reasonable answer if she has pain with cold or not, and we can have a better diagnosis. So she hit on the right side, so we decided to start doing the testing with that cold. It's like a white tube, this diameter. So we place it here, and we said, do you have pain? And the patient said, no pain, but I feel the cold, so that's normal. On this one, oh, she doesn't feel anything, that tooth is dead. That's the meaning, but I talk about diagnosis in another lecture. The point here is to see with a cold test how many teeth are alive. If the patient doesn't answer to any call, the tooth is dead. So in her situation, after all the diagnosis, the tooth that she hit, that was this, and the one next to it were fractured with a diagonal way. So I was doing this kind of image here. This is the root, and here it was like a fracture in this way and this way. But even knowing that the patient said this tooth, after I did this root canal, I find out this tooth also have the same fracture. So these two teeth have to be extracted just because of this dental trauma, dental injury. So it's important that you know that if you need a root canal and they tell you the tooth is fractured, then take it out. But in this situation where the patient is so close to me, I was actually not charging for that in a different way. So this patient now is gonna need more root canals. Look at the image. I'm doing even in the other side because like you see these two, look how they come, the hume of the dry ice coming out. It's a CO2. And the patient is really cooperates a lot. The next test is percussion. So what is percussion? We have to hit tooth by tooth with an instrument that is a metal instrument. And like you see here on the screen, look at the screen. Look at the screen right now. And this is a mirror. I'm explaining there for reels that I did. And look, we're gonna start one by one. And with the hitting, we start on the middle area, that's what I'm saying. And we grab the mirror and we said, tap, 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 do you feel pain? No, no, but here is like she jumps. Yeah, because this is the tooth that's fractured. This one doesn't exist. It was a bridge in here, but the patient had the bridge. So it doesn't matter. She doesn't feel anything, but when you touch this one, she sharps and immediately jumps. So when that happens, you know, this is gonna be a root canal and this is gonna need a root canal. And I have another lecture of when do you know that you need a root canal. In one of the episodes, I have another information for you guys to share. So if you look at the screen right now and look how the mirror is touching the teeth, then that's how we usually do the testing. Tooth by tooth. Why tooth by tooth? Because the answer of this is different to this one, and we don't want to open a tooth that doesn't need a root canal. So it's very important that your endodontist take the time, but remember, not before 14 days, don't do anything. Wait, I would wait 14, 16 to 18 days, unless you are having symptoms. Then we have to operate right away. We have to do something right away to get you out of pain. But look how much I check in the patients in the screen, how much I'm going through all the mouth. So after the percussion comes palpation. And palpation is very nice because we need to palpate on the area of the accident. You know, I went lower with this patient and upper, but upper was the biggest trauma, which is better because this is very resistant jaw. And then she said, I have pain, right when we are, you know, with the finger palpating the area. And we check in this area too. So all of that testing has to be done when you see an endodontist after a dental injury, which is trauma or car accident and you fell the stairs, etc. So look at the screen now, and if you look how I'm working on the patient and showing, telling her, checking if she has any pain, because this is the area where I'm pointing this here is the area of the accident. But now the patient is telling me, see how I stopped right there is because the patient is telling me she feels pain. So I said, I have to go back and I have to really check if this patient is having pain all over the mouth because of the accident or because she grinds her teeth and didn't wear the night guard. But in her case, was literally that her car accident, little by little, the teeth start catching up the information and the brain start telling the teeth, you got affected, you have to go, you got fractured, etc. So it just, to me, diagnosis is fascinating, but you gotta be very present and knowledgeable or text me, call me, send me a message. Don't let anyone to do root canals of the whole mouth. Try to go little by little because the body responds in different ways. So remember, tip number 1, not before 14 days. Tip number 2, you have pain, you have to go immediately to see your dentist. And remember, they have to do palpation, they have to do percussion, they have to do another testing, which is a bite test. They have to check, with your bite before you determine if you bite here, the patient jumps. And if you bite right here, patient jumps. This one, no pain, no pain, no pain. So in that situation, just be sure you're gonna know as a patient the diagnosis, because if we go all over the teeth, guess what? The only one that is gonna answer, that's a very good tip for your diagnosis. You as a patient gonna know that the only one that is answered is this one and this one. And then from these two, one is gonna be worse, and that's the one that you're gonna work in. And this patient was different because it was extremely delicate. It was an accident. The patient was flying to Mexico City, and I didn't want her to have pain. But you don't need to rush any of these treatments. So go by your pain. And after you have that, all this testing, and I find out that these are the ones that are gonna need a root canal, but the MRI, the CT scan says that the teeth are fractured already. But this patient is very close. There's no finances that I have to worry, because it's a patient that doesn't have any issue with keeping her teeth. She doesn't want to lose them. So she says, please do something to save it. What is the next step? So this is the other tip. Once you know what is the root canal, you're gonna need a root canal, okay? Your endodontist is gonna do the root canal. However, in the process, I look at the fractures. So as delicate as I was, because look how small, look how small is the root. It's just fascinating to me, because look at the size. So I always tell the patient, it's like a diamond, this is like a little diamond. This is bigger. I will say this is like a little diamond. And I don't want to even touch it. We have to be so delicate to do anything in these roots. And that's why you patients have to know that an endodontist plays an important part, and it will give you the time to go and see if there's no calcification. And if he knows it's fractured, most likely we have to take it out. In this case, we're just keeping this until the patient was able for that extraction. So now the patient was given the instructions of the tooth is really more fractured. The pieces are not gonna stay for any time. She has to do this before she travels. So that was a critical decision. So if you're gonna travel, plan all of this, but now you know what to do if you have an accident with a traumatized tooth. When we give the instructions to the patient, flossing, brushing, and after that, we deliver a night guard, or she has to use her snore guard that now is using. And Dr. Bijak, I took this picture recently, but because I don't have from Dr. Bijak, but the patient has a partial denture here. She didn't want another implant, but she has a beautiful partial. Dr. Bijak did like 20 years ago. And she has this upper provisionally that she wanted in this color, so it looked like her own teeth. And now we are waiting for the bone. They did a bone graft, and the bone graft, you have to wait 3 months for the bone graft to mature, etc., like any fracture in your body, and then you come back to your oral surgeon or periodontist to put the implant on that area. But right now the patient is coming back soon to have her implants on place, and that's when we're gonna do the part 2 of this treatment. Remember, in this case, the patient now, without this tooth and this tooth, now they place bone here and bone here, and gratefully, Dr. Bijak placed a partial and the patient is happy. If you have any questions, don't forget to subscribe. Press in our link to our channel, Dr. Fanny Yacaman. Follow us on Instagram and TikTok. Thank you so much, and I see you soon.